A pneumonia of unknown cause detected in Wuhan, China was first reported to the WHO Country Office in China on December 31, 2019, confirming 27 cases. 41 cases of COVID-19 published in January 2020 in The Lancet. Human-to-human transmission was confirmed by the WHO and Chinese authorities by January 20, 2020. 571 cases of COVID-19 was reported in January 22, 2020. The outbreak was declared a public health emergency of international concern on January 30, 2020. According to official Chinese sources, these were mostly linked to the Huanan seafood wholesale market, which also sold live animals. In May 2020, George Gao, the director of the Chinese Center for Disease Control and Prevention, said animal samples collected from the seafood market had tested negative for the virus, indicating that the market was the site of an early super-spreading event, but it was not the site of the initial outbreak. There are several theories about where the very first case, the so-called Patient Zero, originated. According to an unpublicized report from the Chinese government, the first case can be traced back to November 17, 2019, the person was a 55-year-old citizen in the Hubei province. By December 2019, the spread of infection was almost entirely driven by human-to-human transmission. On 27 and December 28, Vision Medicals informed the Wuhan Central Hospital and the Chinese CDC of the results of the test, showing a new coronavirus. A pneumonia cluster of unknown cause was observed on December 26 and treated by the Dr. Zhang Jixian in Hubei Provincial Hospital, who informed the Wuhan Jiangnan CDC on 27. On December 30, a test report addressed to Wuhan Central Hospital, from company Capital Biomed Lab, stated an erroneous positive result for SARS, causing a group of doctors at Wuhan Central Hospital to alert their colleagues and relevant hospital authorities of the result. That evening, the Wuhan Municipal Health Commission issued a notice to various medical institutions on the treatment of pneumonia of unknown cause. 8 of these doctors, including Li Wenliang, punished on January 3, were later admonished by the police for spreading false rumors, and another, Ai Fen, was reprimanded by her superiors for raising the alarm. During the early stages of the outbreak, the number of cases doubled approximately every 7.5 days. In early and mid-January 2020, the virus spread to other Chinese provinces, helped by the Chinese New Year migration and Wuhan being a transport hub and major rail interchange. On January 20, China reported nearly 140 new cases in one day, including 2 people in Beijing and 1 in Shenzhen. Later official data shows 6,174 people had already developed symptoms by then, and more may have been infected. A report in The Lancet on January 24 indicated human transmission, strongly recommended personal protective equipment for health workers, and said testing for the virus was essential due to its pandemic potential. On January 31, 2020, Italy had its first confirmed cases, 2 tourists from China. As of March 13, the WHO considered Europe the active center of the pandemic. On March 19, Italy overtook China as the country with the most deaths. By March 26, the United States had overtaken China and Italy with the highest number of confirmed cases in the world. Research on coronavirus genomes indicates the majority of COVID-19 cases in New York came from European travelers, rather than directly from China or any other Asian country. On June 11, after 55 days without a locally transmitted case, Beijing reported the first COVID-19 case, followed by 2 more cases on June 12. As for June 15, 79 cases were officially confirmed. Most of these patients went to Zinfadi wholesale market. Based on Johns Hopkins University statistics, the global death-to-case ratio is 5.4% as of June 17, 2020. Sex differences. The Chinese Center for Disease Control and Prevention reported the death rate was 2.8% for men and 1.7% for women. Later reviews in June 2020 indicated that there is no significant difference in susceptibility or in CFR between genders. One review acknowledges the different mortality rates in Chinese men, suggesting that it may be attributable to lifestyle choices such as smoking and drinking alcohol rather than genetic factors. Ethnic differences. In the U.S., a greater proportion of deaths due to COVID-19 have occurred among African Americans. Greater prevalence of lacking health insurance and care and of underlying conditions such as diabetes, hypertension, and heart disease also increase their risk of death. In the UK, a greater proportion of deaths due to COVID-19 have occurred in those of a Black, Asian, and other ethnic minority background. Several factors such as poverty, poor nutrition, and living in overcrowded properties may have caused this. During the initial outbreak in Wuhan, China, the virus and disease were commonly referred to as coronavirus and Wuhan coronavirus, with the disease sometimes called Wuhan pneumonia. In the past, many diseases have been named after geographical locations, such as the Spanish flu, Middle East respiratory syndrome, and Zika virus. The official names COVID-19 and SARS-CoV-2 were issued by the WHO on February 11, 2020. Other animals. Humans appear to be capable of spreading the virus to some other animals. A domestic cat in Liege, Belgium, tested positive after it started showing symptoms, diarrhea, vomiting, shortness of breath, a week later than its owner, who was also positive. Tigers and lions at the Bronx Zoo in New York, United States, tested positive for the virus and showed symptoms of COVID-19, including a dry cough and loss of appetite. Minks at 2 farms in the Netherlands also tested positive for COVID-19. In March 2020, researchers from the University of Hong Kong have shown that Syrian hamsters could be a model organism for COVID-19 research. No medication or vaccine is approved to treat the disease. The World Health Organization suspended hydroxychloroquine from its global drug trials for COVID-19 treatments on May 26, 2020 due to safety concerns. France, Italy, and Belgium also banned the use of hydroxychloroquine as a COVID-19 treatment. USA, Brazil, Russia, India, UK, Spain, Italy, Peru, Iran, Germany, Chile, Turkey, France, Mexico, Pakistan, Saudi Arabia, Canada, Bangladesh are the country on June 17, 2020 surpasses the China in SARS-CoV-2 cases.